The laser technology is something that women need to look into very closely and check that they are in fact getting the right treatment for what they need. To my way of thinking, a laser is a superficial treatment which treats in the vagina or in the gynaecology setting the mucous membranes of the vagina. Some devices also have a thermal pass that treats the slightly deeper layers, but that in essence the technology is used to make tiny little holes in the mucosa of the vagina that then means that cells and blood flow comes into the area and aims to thicken up the lining of the vagina so that it goes from often a post-menopausal thinning state to a more premenopausal thickened state where the rugae in the vagina comes back and the lubrication comes back. I use the Juliet Laser, which I have for women who are usually post-menopausal. A lot of women use the laser when they have had breast cancer and are taking anti-estrogen tablets. Many of these women do not wish to have any form of estrogen, so options such as using HRT or a vaginal estrogen cream are no longer options that they wish to consider. So for these women, the ability to have a treatment that is non-hormonal, that improves their sex life, is life-changing. Other women find they just want as much benefit as they can possibly get. They use some vaginal cream. Yes, it works, but they don't wish to keep using it every day, and they want as much normal function as they can possibly get. There are a number of different lasers around in Australia that women could consider using. There is a carbon dioxide laser and an erbium YAG laser. I use an erbium YAG laser, which is FDA approved and is seen as a therapeutic laser for gynecologists within the Gynaecology College. I like the Juliet Laser, which is an erbium YAG laser, because it does two passes within the vagina. One is the superficial treatment to the mucosa, and the second, slightly deeper treatment will also help with some of the slightly deeper collagen fibers and some slight decrease in urgency that a lot of older women have. A laser treatment can be done in one session, or it can be done in a series of 2 treatments where a lighter dose of laser energy is used. And I think for older women, this is safer technology, as women can try it the first time. They make sure that there's no significant pain, burning or damage, and if they get an improvement, they can come back for a second treatment. Because there are little holes made in the vagina, all of my patients have an examination first and a swab test to make sure there is no infection before they go ahead with the treatment. If we are using the laser on the introitus, just at the outside of the vagina, some numbing cream is used just for the areas that might be a bit more sensitive, where the mucosa meets with the skin areas. The other thing that a laser can be used for is for women with lichen sclerosis, which is a thickening of some of the tissue around the opening to the vagina. In general, the only treatment so far for this itchy and irritable and painful condition for women is long-term steroids. What some papers are suggesting is that the use of laser improves the blood supply to the area, and that women are getting a significant improvement with their lichen sclerosis, which makes sexual intercourse and general day-to-day living a lot more comfortable.